Alcohol and prescription drug unit provides help to a wide range of people, both male and female. There's a broad range of people within the community that have problems, all the way from people in so-called blue-collar jobs, office jobs, professional jobs. And the age range is quite broad as well, all the way from early 30s through to into the 60s, and probably some people younger than that and older than that as well. There tend to be two cohorts. There's either younger people who have substantial problems with anxiety or depression and self-medicate with those prescription drugs, or you get the people probably 40s, 50s onwards, a mixture of anxiety, depression, chronic pain, who become over-reliant on those medications. Generally, people will seek admission for an alcohol prescription drug problem when treatments in the community aren't working. Naturally, most people attempt themselves to cut back their drinking. They might seek help from a GP or go to AA or seek some counselling, but it gets to a point for some people that it's just not working. They're waking up in the morning, determined not to have a drink, and then they have 2 bottles of wine that night. And it's at that point that they realise that they've lost control. And it's that loss of control that's a really important factor in seeking hospital treatment. The other factors, of course, are the complications of the alcohol and the prescription drug use. Effects on the marriage, effects on work, legal, drink driving offences, friends commenting, and of course general health problems as well. Access to the clinic is very straightforward. There is a dedicated intake line and team, and the person can contact the team or their referring doctor can, and then the clinic arranges for myself or one of the treating psychiatrists to admit the person and take their details and just generally organise everything. Very straightforward. The clinic at New Farm is in lovely surroundings. People familiar with New Farm know it's down by the river. There's a lot of areas for walking and exercise, and the clinic environment's a very modern, new environment. It is, of course, voluntary treatment, as all substance treatment is, alcohol prescription drug treatment. People make the decision themselves that they're seeking treatment and come in voluntarily. The general length of stay is probably around 2.5 to 3 weeks. The first several days up to a week would be detox, and then there's a dedicated 2-week group program thereafter. The day-to-day treatment involves groups, 3 a day, Monday through Friday, and then groups on weekend as well. There's also one-on-one counselling with the team psychologist, and of course there's also the general interaction one-on-one with the nursing staff who have a lot of experience in alcohol and drug treatment. The clinic has a day patient follow-up program which runs once a week, and it's really around so-called relapse prevention strategies. So it's a chance to check in, review the treatment plan, how it's going, fine-tune, work out what needs to be different, also identify early signs of relapse and maybe need for readmission. And of course, in general, the person will also follow up with their treating psychiatrist as an outpatient.